The World Health Organization and the CDC are at odds over who exactly should be getting COVID-19 shots and boosters at this point in the pandemic. Lucas Tomlinson has more.
COVID vaccines are still a requirement in many school districts across the country, but new guidelines could change that. The World Health Organization updating its COVID vaccine recommendations, saying healthy kids and teenagers without pre-existing conditions are not a priority for the COVID vaccine. The revisions reflect a new focus on prioritizing vaccines for those at highest risk as the outbreak moves from the pandemic to the endemic stage.
We need to do a reset right now and learn how to live with this virus for probably to the end of time. It's going to be with us.
The WHO also pointing to higher immunity levels around the world due to vaccines and prior infection, two metrics the White House cited recently as it moves forward with a plan to end the COVID national emergency next month.
We are in a different place and time than we were in January. We've been winding down authorities over the last 2 weeks, over the last 2 months.
But the CDC is standing firm on its own guidelines, recommending everyone aged 6 months and older stay up to date with vaccines and boosters. CDC officials tell Fox News the new WHO guidelines are meant to provide flexibility to individual countries. And some of those countries, including India and China, are still dealing with high rates of infection.
People should follow COVID-appropriate behavior. And if they have not got themselves vaccinated, get themselves vaccinated.
The CDC also claims its independent analysis of children receiving the COVID vaccine found that the benefits still outweigh the risks. In Washington, Lucas Tomlinson, Fox News.